Okay, so I'm going to be setting up my Piggyback infusion. I'm going to need a Piggyback administration set. So this is my secondary bag and my secondary tubing because we're going to be administering chloroform 560 milligrams IV Piggyback every 8 hours. And then we are going to use the secondary tubing for it. Make sure you have your right medication. You're going to use the 6 rights, which are right patient, right time, right route, right dose, and right documentation. And then you're going to make sure it's not expired. You're going to take off the cap of your medication, clean it off with an alcohol swab, and get that ready and set aside. You want to clean both with alcohol swabs, and I'd use a new alcohol swab. So I'm going to get those set up to the side. And then I am going to take my cap off the solution bag and spike the bag. And then I'm going to make sure the roller clamp is closed. I'm going to use this to hang the Piggyback above the primary. So my primary is going to be hung down below. And my secondary will be hung above. I'll show you this once I get it set up. So this is it set up, the Piggyback on top, primary and bottom. Going to press this to fill it halfway. And now that it's filled halfway, it's good. So I have to mix my medication into my bag, so I'm going to grab it down. And I should have mixed the medication before spiking the bag. Brain fart, but yeah, so this is supposed to be off, and I'm going to administer my medication first and then spike the bag. So I'm going to get my medication ready since it's already spiked. Going to use 560 milligrams, like it says on the order. So I'm going to use 6 milliliters. So I need to clean the tops, which I already did. And actually I need to grab a new needle since I already inserted it, but I'm going to drop 6 milliliters. I'm going to put it into the powder. This goes in the sharps container. And then I'm going to mix it slowly in my hands. Before all this, I should be washing my hands. And I'm going to take the cap off, get the medication. Okay, now that I have my medication, going to administer it. And I'd want to clean the port with an alcohol swab before this goes in the sharps. And to mix the medication, you're going to invert the bag like this. And you're going to hang it. And before giving a medication, before and after, you're going to flush it. So I didn't show that because I showed the flush in the last video with the saline lock. But you're going to want to flush it before and after, 5 milliliters. Make sure you're emptying 2 milliliters into the garbage for cleanliness technique, aseptic technique. And then the patient will be monitored just like any other IV patient. You need to check the site, check how they reacted. The primary tubing needs to be connected after the medication administration. The secondary tubing needs to be connected to the port closest to the roller clamp closest to the solution bags. So I'm doing that. You want to make sure not to get this dirty. If you're unconnecting it and connecting it again, alcohol swab it. So those are connected, and you're going to determine the drip rate, which is 11 drops per minute for the second drip rate for the IV Piggyback. And you're going to want to apply gloves. First, wash your hands. Apply gloves to take the IV set off. So, going to want to gently remove the edges of the tegaderm. This is very sticky. If it's sticking, you can use an alcohol swab, rub underneath it, try to get it off better. And then I'm going to press gently above the catheter tip and remove the IV. And put it in the sharps container. I'm going to place a gauze pad if there's any excess bleeding, and tape the gauze pad to the site. This tape isn't long enough, but pretend it is. So tape the gauze pad to the site because it is bleeding a little bit. And you're going to document how the patient responded, if there's any pain before, after, and during IV therapy. So this is for the last video, taking it out, and I know I took it out on the Piggyback video too. I'm going to pretend the saline lock is on, but I didn't have any extra saline locks from when I took out the last one on the last video. So the Piggyback tubing is set to it. I'm going to first wash my hands, apply gloves. I'm going to prepare my medication to the 6 right patient, right time, right dose, right drug, right route, right documentation. And then I'm going to assess the site, and I'm going to loosen the tape once I have gloves on, obviously. I'm going to make sure that I checked the MAR and that I am identifying my patient by 2 identifiers, patient name and date of birth. I'm going to assess the site. We don't want pain, burning, swelling, any of that sort, anything abnormal. And then I'm going to detach the tubing, and before I do detach it, I want to make sure that all my clamps are locked, and they are. This just makes sure that the IV administration set is shut off. So I'm going to unattach the tubing, place my finger, I have gloves on, place my finger at the top and remove the catheter. You want to teach the patient how to maintain the site, assess it, and just make sure to tell them to report if there is any abnormal burning, pain, or any sensation around the site, swelling, discoloration. And you're going to want to document all the data pertinent to this. And then, like I did in the last video, the gauze should be placed over with tape for the removal of it. I did kind of get out of order with stuff on the videos. However, I think it's most important that I know like what I'm doing, obviously. With all the videos, it was hard to stay in order, I felt like, with the way the directions were. So, if that is confusing, sorry. And also, just make sure that when you are doing your IV push, you're going to do the IV push, obviously the saline lock, if it was there, you'd do the saline lock IV push, or the most common method is to do the IV push closest to the port. Before, I did miss another step. Before taking out the IV, part of the removal step is to flush the catheter with 5 milliliters of saline before removing it. So because I did that in the video for the IV push before and after like I was supposed to, I didn't show that step again, but I did want to mention it to make sure that I did include it you really want to make sure to flush. That's a very important step. And other than that, I think that is all for my videos.